Hello friends, today we are going to discuss fatty liver is silent but may kill you if you won't care. Is life worth living? It all depends on the liver, says William James. Now, what is fatty liver disease? Fatty liver disease, steatosis, is a common condition caused by having too much fat build up in your liver. A healthy liver contains a small amount of fat. It becomes a problem when fat reaches 5% to 10% of your liver's weight. This is the position of your liver at the right upper quadrant of abdomen below the diaphragm. Stages of liver damage. In the first picture, there is a healthy liver. In the second, there is non-alcoholic fatty liver disease, which is reversible. And in the third, it is cirrhotic liver, which is irreversible. Fatty liver disease is a condition in which fat builds up in your liver. There are two main types: non-alcoholic fatty liver disease and alcoholic fatty liver disease, also called alcoholic steatohepatitis. Why excess liver fat is bad? In most cases, fatty liver disease doesn't cause any serious problems or prevent your liver from functioning normally. But for 7% to 30% of people with the condition, fatty liver disease gets worse over time. It progresses through 3 stages. Your liver becomes inflamed or swollen, which damages its tissue. This stage is called steatohepatitis. Scar tissue forms where your liver is damaged. This process is called fibrosis. Extensive scar tissue replaces healthy tissue. At this point, you have cirrhosis of the liver. Cirrhosis of the liver is a result of severe damage to the liver. The hard scar tissue that replaces healthy liver tissue slows down the liver's functioning. Eventually, it can block liver function entirely. Cirrhosis can lead to liver failure and liver cancer. Cirrhosis may cause symptoms such as abdominal pain, loss of appetite, weight loss, weakness or fatigue, nausea, itchy skin, yellow skin and eyes due to jaundice, easy bruising or bleeding, dark colored urine, pale stools, fluid accumulation in the abdomen called ascites, swelling, edema of your legs, web-like clusters of blood vessels under your skin, breast enlargement in men, gynecomastia, and confusion. Types of fatty liver disease. There are two main forms of fatty liver disease. One is alcoholic liver disease and other is non-alcoholic liver disease. Alcoholic fatty liver is the accumulation of fat in the liver as a result of heavy drinking. Moderate drinking is defined as 1 drink a day for women, that is 30 cc, and up to 2 drinks per day for men, 60 cc. About 5% of people in the US have this form of liver disease, 5%. And the non-alcoholic fatty liver disease, non-alcoholic fatty liver disease is a type of steatosis that's caused by factors other than excessive alcohol use. The exact cause is not completely understood, but it often occurs with other metabolic disorders such as high cholesterol, obesity, and diabetes. Non-alcoholic fatty liver disease affects about up to 25% of people worldwide, 1/4. Most people won't have symptoms, and some may never know they have the condition. But 2% to 5% of people will experience complications from the fat in their liver. When fat leads to inflammation and cell damage in your liver, it is called steatohepatitis. The non-alcoholic version is called non-alcoholic steatohepatitis, NASH. What are the symptoms of non-alcoholic fatty liver disease? People typically don't experience symptoms until non-alcoholic fatty liver disease progresses to non-alcoholic steatohepatitis. With NASH, you may begin to have symptoms of inflammation, but you may not notice symptoms until NASH has progressed to more severe liver damage. Non-alcoholic fatty liver disease merely lays the groundwork. Abdominal pain or a feeling of fullness in the upper right side of the abdomen or the belly. Nausea, loss of appetite or weight loss. Yellowish skin and whites of the eye called jaundice. Swollen abdomen and legs edema. Extreme tiredness or mental confusion and weakness. What causes a fatty liver in non-alcoholic? Metabolic syndrome. Non-alcoholic fatty liver disease seems to be linked to a group of related metabolic disorders involving high BMI, high blood lipid levels, high blood pressure, and diabetes. These factors seem to influence each other and lead to collective changes in how your body metabolizes nutrients and stores fat. Diet and nutritional causes. Researchers have also found that a diet high in fructose may increase your risk of developing non-alcoholic fatty liver disease. Fructose is one of the ingredients in common table sugar and is the dominant ingredient in high fructose corn syrup, a common sweetener. It is highly linked to metabolic syndrome. Genetics. Certain genes may make you more likely to develop non-alcoholic fatty liver disease. This may help explain why some people get it without any of the other common risk factors. It may also help explain why people of certain races seem to get it more often. Diagnosis and treatment. Diagnosis and tests. Because fatty liver disease often has no symptoms, your doctor may be the first one to spot it. Higher levels of liver enzymes, elevated liver enzymes that turn up on a blood test for other conditions may raise a red flag. Elevated liver enzymes are a sign your liver is injured. To make a diagnosis, your doctor may order ultrasound or computed tomography CT scan to get a picture of the liver. Liver biopsy tissue sample to determine how far advanced liver disease has progressed. Fibroscan, a specialized ultrasound sometimes used instead of a liver biopsy to find out the amount of fat and scar tissue in the liver. Treatment. There is no medication specifically for fatty liver disease. Instead, doctors focus on helping you control factors that contribute to the condition. They also recommend making lifestyle changes that can significantly improve your health. Treatment includes avoiding alcohol, losing weight, taking medications to control diabetes, cholesterol and triglycerides, fat in the blood, taking vitamin E and thiazolidinediones, drugs used to treat diabetes such as Actos and Avendia in specific instances. Is non-alcoholic fatty liver disease reversible? While there is no medicine yet to reverse fatty liver disease, diet and lifestyle changes can help. Many people find that they can slow, stop, and even reverse the fat accumulation in their liver by controlling metabolic factors such as weight, cholesterol, and other blood lipids, blood pressure, and blood sugar. However, once NASH progresses to cirrhosis of the liver, the damage becomes more permanent. If you control your insulin resistance by taking very low carbohydrate diet, you can reverse it. How long does it take to reverse non-alcoholic fatty liver disease? Healthcare providers recommend losing at least 3% to 5% of your body weight to begin to see results in your liver. Current research suggests that even 1% weight loss may improve the outcomes. They also recommend that you aim to lose no more than 1 to 2 pounds per week. Rapid weight loss can make non-alcoholic fatty liver disease worse. Take your time with a conservative diet and exercise program. Aim for 30 minutes of exercise a day. Management of non-alcoholic fatty liver disease / NASH. Weight loss. 52-week intervention of physical activity and calorie restricted diet. 30% of patients lost 5% or more total body weight. 58% had resolution of NASH. 82% had a 2-point reduction in non-alcoholic fatty liver disease activity score, that is NAS. 10% of patients lost 10% or more total body weight. 100% had reduction in NAS. 90% had resolution of NASH, and 40% had regression of fibrosis. Diet modification. Calorie restriction. 500 to 750 kilocalories per day calorie deficit. Low carbohydrate versus low fat. Similar reductions in hepatic fat with MR spectroscopy. Similar reduction in alanine transferase and insulin resistance. Mediterranean diet. Beneficial for all-cause mortality, cardiovascular disease, cancer, obesity, and diabetes mellitus 2. Reduces central obesity. Non-alcoholic fatty liver disease patients, similar weight loss compared to low-fat diet, but significant improvement in reduction of hepatic steatosis, MRS, and improvement in insulin sensitivity. Physical activity. Liver-related benefits of exercise. Improved peripheral insulin sensitivity, decreased hepatic de novo lipogenesis. Reduction in visceral fat, reduction of lipid delivery to the liver, increased hepatic VLDL clearance, vigorous activity in non-alcoholic fatty liver disease. More than 75 minutes per week have a reduced risk of NASH. More than 150 minutes per week have a reduced risk of advanced fibrosis. Aerobic exercise versus anaerobic resistance training both reduce hepatic fat content, 20 to 30% relative reduction, independent of weight loss. Prevention of non-alcoholic fatty liver disease controls your metabolic syndrome by controlling your insulin resistance, control body mass index, control blood pressure, control blood glucose, control triglycerides, increase HDL cholesterol. Regular checkups for alcoholic fatty liver, avoidance of alcohol is the key. Will fatty liver disease kill you? Fatty liver disease doesn't cause major problems for most people. However, it can turn into a more serious problem if it progresses into cirrhosis of the liver. Untreated cirrhosis of the liver eventually leads to liver failure or liver cancer. Your liver is an organ you can't live without. You may need liver transplant or death. Which diet is good for fatty liver? Follow a balanced diet to lose weight slowly but steadily. Rapid weight loss can actually make fatty liver disease worse. Doctors often recommend the Mediterranean diet, which is high in vegetables, fruits, and good fats. Ask your doctor or nutritionist for advice on healthy weight loss techniques. What should be avoided in fatty liver? Fatty liver foods to avoid: poultry except for lean white meat, full fat cheese, yogurt except low fat, red meat, baked goods and fried foods made with palm or coconut oils, sugary items like candy, regular soda, and other foods with added sugars, including high fructose corn syrup, alcohol. Thank you very much for your patient listening.